Good afternoon, everyone. My name is Dr. Jodie Guest. I'm an infectious disease epidemiologist, professor and vice chair of the Department of Epidemiology at Rollins School of Public Health here at Emory University. I lead Emory's COVID-19 outbreak response team and am the host for Emory's COVID-19 video events, where we cover important topics about the COVID-19 pandemic. Today, I am pleased to be joined again by my friend and colleague, Dr. Carlos Del Rio, so that we can update you about the most recent information that we have about the Omicron variant. Dr. Del Rio is a distinguished professor of medicine, epidemiology, and global health at Emory, and is the executive associate dean of Emory University School of Medicine at the Grady Health System. While Dr. Del Rio has been recognized by many honors, I want to mention that he was recently given, just last week, the Phoenix Award by Mayor Keisha Lance Bottoms in Atlanta for the work that he has done advising her administration on COVID-19. This is Atlanta's highest honor, and all of us at Emory are lucky to work with you, Dr. Del Rio. So congratulations.
Thank you, and really happy to be with you.
Thank you. So welcome, and thank you for joining me today. Dr. Del Rio and I will be presenting a summary of what we currently know about Omicron, recognizing that there is still much we do not know, but we have learned a lot since our last video. Early evidence about the variant has only begun to emerge, and it remains unclear how infectious Omicron will be compared to other variants and how this will lead to hospitalization and death. But again, data are coming in. The variant does seem to be able to partially evade vaccine protection, but it's not yet determined to what degree vaccine protection will continue to protect us with severe disease and death. We do have also some new data about prior infection and how Omicron works with that, and we will get to that today as well. We're going to start talking about transmissibility of Omicron. When we did the last video on this on November 30th, it was not yet clear whether Omicron is more transmissible compared to other variants, including Delta. Although the variant was only identified the day before Thanksgiving, as more data emerges, it is confirming the idea that Omicron's ability to spread fast is incredibly fast, and probably twice as fast as Delta, which has dominated the global pandemic since the summer. In fact, there are now enough data to estimate the reproductive number or contagiousness in the United States at 3. With this high level of transmissibility, cases seem to be doubling every 3 to 4 days. So Dr. Del Rio, at the rate that this is spreading, do you think that Omicron will be the dominant variant in the coming weeks in the United States?
Yes, as you know now, Jody, within CDC, there's a Center for Pandemic Forecasting. There's a group of modelers that are looking at this. And yesterday I had the chance of looking at some of their data, and they do predict that by probably mid-January, Omicron is going to be the predominant variant. It's going to displace Delta simply because it's much more transmissible. We're seeing cases double, around the world every 2 to 3 days. And it looks like, at least in household context, there's about a 3-fold higher transmission than that of Delta. So lots of infections, lots of transmission, and therefore leading to becoming the predominant variant throughout the country in a very short period of time.
The timing on this is really not very good. For the first time in several months in the United States, cases, hospitalizations, and deaths are again increasing. And this is before Omicron really become the predominant variant in the US. What are your predictions for the holidays in January? We're going to get into some more specific questions, but just overall, what is your prediction for the coming months?
Well, at this point in time, we see Delta still the predominant variant throughout the country. And we have to emphasize that it's Delta that is driving the increase in cases, hospitalizations, and deaths, primarily in northern states and primarily among unvaccinated individuals. So vaccination continues to be our number one strategy, and we got to get vaccinations are going up. We have now, a little bit over 60% of the population vaccinated, but we also have to get people who are vaccinated boosted, and it's particularly important that we get boosted those at high risk of disease, people over the age of 60. But everybody now pretty much can get a booster. I still have a little bit of data whether somebody's 16, a little bit of hesitation to say somebody 16 or 17 year old should get a booster because the risk of disease is low. But if you're 30 years of age and older, you should probably get a booster, and I think it would protect you in a significant way against Delta. We also have to say, though, that the protection against Omicron is not as good with full vaccination, but getting boosted also increases your level of protection. So one of the reasons to get boosted is the upcoming Omicron. When people say, how do I get prepared for Omicron? I said, get boosted. Clearly, we see a better protection if you get boosted.
Absolutely.
The other thing we have to do is we have to get access to testing. And the president promised that we will get free testing. We're not there yet in our country, and I really don't know what we're waiting for, because quite frankly, we were able to get free checks to people last year. We ought to be able to get free COVID tests for people, but be nice to get them for Christmas.
That would be a great Christmas present. Testing is incredibly important as we move forward. And in some of the testing events I've done recently, we see not a lot of interest in it. And hopefully that's some people moving to testing at home. But again, we want to reiterate, it is important to stop the spread of COVID-19.
Well, Michael Mina, who is an Emory grad and somebody who has written a lot about testing and who I personally like and know very well, he's very smart. He talks about testing. There are different types of testing, right? And there's diagnostic testing. So if I have symptoms, I go get tested. If I need to travel, I go get tested. But there's also, sort of public health screening testing. And public health testing is what, we go into community, just test people, see how common the disease is. But screening testing is that testing you do before certain things. And for example, if I'm going to go ahead and get together with my family, let's get everybody tested. And I would say it really matters who's going to be in your household, right? If I'm getting together for the holidays and I have my 97-year-old mother there, we need to be sure everybody's uninfected. If I'm getting together for the holidays and everybody's going to be there in their 30s or 40s, well, we have transmission. Nobody, it's okay. Nobody really cares. That's okay. You don't need to get tested. But if you're going to be around people that are high risk, you really want to get tested. And it's important that we realize these tests are not perfect. So ideally, you want to get tested like 24 hours before the event and right before the event. So repeat the testing, do it twice. The packages of, for example, the Binax test that you get in CVS or Walgreens, they come with 2 tests, and they come to 2 tests with 2 tests precisely because of that. You should test yourself twice. And by doing that, you dramatically increase the level of the predictive value of the test.
Absolutely. And I don't know that we've ever said that's why Binax now comes with 2 per pack, but thank you for pointing that out for everyone. Let's move to Omicron's severity of disease and hospitalization. Looking at some of the data, mostly from South Africa that we have so far, it's, again, not yet totally clear whether infection from Omicron causes more severe disease compared to other infections with other variants. And a lot of conversation on social media about the fact that it's less severe disease. What we know is that Omicron cases continue to flood South Africa, and a snapshot of the first 3 weeks of each of the 4 waves that South Africa has endured with COVID-19 shows that hospital admissions are significantly lower during the Omicron-driven 4th wave compared with the Delta wave or the Beta variant wave. Hospitalization rates are still lower with Omicron than earlier waves, but this is anecdotal data for the most part. And they're seeing that people who are being admitted have milder illness, shorter hospitalization stays, and are less likely to require ventilation. And some of the data I've seen show about 16% of those in South Africa who are currently hospitalized with COVID-19 have been vaccinated. So a bit of a difference, but still a lot of protection from vaccines. These data were released last Tuesday, and they're just the first 3 to 4 weeks of Omicron in South Africa. Talk us through the normal lag we see between cases and hospitalizations, and how much should we depend on this data as really representing that this is a more mild variant?
Well, the first thing I tell people is currently, even with all the progress that is being made, we know more about what we don't know than what we do know about Omicron. And we are learning as we go, and we're learning little by little, and sometimes pretty fast. Hospitalizations have been slower this time around, but a couple of things that I want to caution people about is people in South Africa right now getting infected are younger, are young adults that in general tend to do well. And when we see people getting infected in other countries, primarily they tend to be travelers, right? And travelers by definition tend to be healthier individuals. If you're sick, if you're in a nursing home, you're not going to travel. So I want to see Omicron sort of spread through a nursing home before I say this is mild disease. I want to see it affect a high risk, vulnerable population before we say it's mild disease. And I'm worried that many of our nursing home and long-term care facilities in this country have very low boosting rates. And we got to get people there boosted, because if we see Omicron in that population and it spreads rapidly, we may really realize that it's not such a mild disease. Even if, let's suppose, even it's mild disease, what I tell people frequently, people say to me, well, it's mild disease, we don't need to worry about it, just let it spread through the population. Well, be careful what you want for, because even if it produces very mild disease, if it infects a lot of people, it's going to end up in a lot of hospitalizations. I mean, if you got 100,000 infected individuals and the hospitalization rate is 2%, that's 2,000 people ending up in the hospital. So you can see a lot of hospitalizations just by the sheer numbers. So limiting transmission still continues to be critically important. And I would not, just count my blessings saying, oh, this is mild, I don't need to worry about it.
I agree with you. And though neither one of us are economists and aren't going to pretend that we are, the economic impact of a whole bunch of people being mildly sick and not being able to go to work is also something that we should be concerned about if this does happen to be a more mild variant, in addition to the fact that just by sheer numbers, we will flood our hospitals potentially.
It's interesting what you said right now, because it's going to be really interesting what the transmission dynamics of Omicron are going to be, precisely because we're coming up on the holidays, right? People are not going to be at work, but they're going to be gathering within households. And I suspect we're going to see a significant sort of post-holiday spike. We've seen this in the past. We've seen it in Thanksgiving. We've seen it in many other holiday spikes. And I suspect this is going to be a very significant holiday spike.
I'm afraid that you are right as well. Let's move for a moment to discussing our vaccines. Those of us who are vaccinated and are working hard to get everyone towards vaccinations have been waiting impatiently, but trying to be patient about the vaccine efficacy data about Omicron and how well it will continue to protect us. The fact that there are fewer people dying in South Africa from Omicron compared to previous variants suggests that vaccines, though they aren't preventing necessarily all infections, may be stopping severe cases. There is a South African study that just came out, which again is based on only 3 weeks worth of data, that shows that vaccines are not quite as effective against the variant, which poses a higher risk of breakthrough infections. We also, to go with that, have now 8 lab studies, all largely saying the same thing. Omicron significantly reduces the number of neutralizing antibodies from a 2-dose mRNA series compared to previous variants. This made a lot of headlines the end of last week and over the weekend, but it's really important to note, reduction in neutralizing antibodies is not the same thing as reduction in vaccine effectiveness. So Dr. Del Rio, can you walk us through the differences between those two things?
Well, but let's start by saying that the first thing is lab data is not the same as clinical data. And I think that's what's easier for people to understand. What we're seeing right now is results from, as you mentioned, 8 studies in which we're looking at rise and ability to neutralize the virus with vaccines in laboratory samples. And that's going to be very different than in real efficacy in clinical samples. And that is because immunity is a lot more than antibodies. The data from antibodies, for example, with the Pfizer vaccine, is if you're talking about the Delta variant, we know that the protection against Delta, the efficacy, the neutralizing ability of antibodies against Delta is lower than against Alpha or the original strain. If you're about 5 months out of your vaccination with Delta, you probably have about a 60% efficacy. If you get boosted 2 weeks after you've been boosted, your efficacy, your protection goes up to 95% again. Now, against Omicron, 2 doses only gives you probably about 35% efficacy. And if you get boosted, you get up to about 75% efficacy. So even boosting doesn't get you to where boosting did on Delta. This is in the laboratory. We now need to see what happens in the clinic, and may be very different in the clinic. But I'm afraid that the vaccines are not as good against the current vaccines are not as good against the Omicron strain that they were against prior strains, even if you get boosted. But if you want to have the best protection possible, get boosted. But understand that it's not sufficient, and therefore why masking and other measures continue to be important.
I think that is exactly right. Boosting we need to get everyone to boosting. We're going to talk about the kind of low numbers that we have of that in the United States, but that is not our way out of this. Do you Do you believe that the definition of being fully vaccinated will change to include a third dose of mRNA, or that it should? And if you got Johnson & Johnson originally, that it should now be a 2-dose series?
Well, today the CDC is actually meeting to talk about Johnson & Johnson vaccine. I personally think that I'm not recommending any more Johnson & Johnson vaccine. I really think at this point in time, what we've learned from a variety of studies is you're better off at least, getting an mRNA vaccine. So if you receive Johnson & Johnson, get boosted with an mRNA vaccine. I think it's really important that we realize that, and we'll see what the ACIP says today during their meeting. Do I think the definition of fully vaccinated should include a third shot? Yes, I think so. I think in this point in time, in my book, what I'm doing myself, what I'm telling my relatives, my family, my patients, is full vaccination includes 3 doses. Do I think the CDC and the government is going to change that? And do I think it's going to change the requirement at universities and at other places? I'm not sure. We may see, depending on what happens with Omicron and how it spreads, they may change the definition. I know that some schools, some universities, Syracuse, for example, is one of them. Carleton is another one, has already required in their students and their staff proof of boosting in order to start the spring semester. We haven't done that here at Emory, and I'm not aware that we're even close to saying that. But again, one thing is the requirement and what the definition is, and the other one is what is important and what's the reality. And to me, the best thing you can do is to get boosted at this point in time.
I think I read yesterday that the NFL is also requiring boosts for their staff who have any sort of interaction with teammates or players, as well as the universities that you pointed out. CDC did have a call yesterday where they stressed that early data shows that individuals who are fully vaccinated and received a booster shot remain largely protected against severe illness and death from Omicron. In the United States, currently, about 52% of those over the age of 65 in the US have been boosted, but only 27% of the US population has been boosted. Are you worried about what a low rate this is?
Well, I'm worried about 3 things. I'm worried about the 60% that have not even started vaccination, that are not vaccinated. I worry that many of them have not gotten vaccinated because they say I already had disease and I have natural immunity. And I will remind people that while this so-called natural immunity, and I don't like to call it natural immunity, I'd like to call it post-infection immunity, because the vaccine immunity is also natural. The after infection immunity provides some level of protection against Delta. It provides no protection against Omicron. So we have essentially 40% of the US population yet to be vaccinated. And then we have, as you say, only 20% boosted. So I think we're in for some big trouble. If Omicron indeed is as transmissible as it is, and it causes even mild disease, I think we're going to have serious trouble. And I'm looking for a very complicated winter coming ahead.
Let's move to this idea of natural infection or post infection immunity. A study over the weekend showed that neutralizing antibodies among people previously infected with alpha, beta, or delta, but not vaccinated, completely failed to protect against Omicron. Those who were infected and vaccinated in either order, infection and then vaccination, or in vaccination and then a breakthrough infection, had a very strong response to Omicron. These data seem to clearly show that we do not want to chance fighting Omicron by counting on a previous infection to protect us. So how soon after infection should someone get vaccinated? And what do you say to people who are still using infection as their mode of protection?
What I tell people that are still using infection as a mode of protection is get vaccinated. Get at least 1 dose of vaccine, even if you're not fully vaccinated. Just take 1 dose of vaccine, because then you'll be super immune. Shane Crotty, who was a postdoc here in Rafi Ahmed's lab and who's now a professor in Scripps, calls this hybrid immunity. He says, there's natural immunity, there's vaccine immunity, and there's hybrid immunity. Hybrid immunity is the best immunity. I call this super immunity. I tell people, you want to be super immune. You want to be the best protected ever. And in fact, I've never had COVID. I immunized, I'm boosted. I'm less protected than somebody who got COVID and then got vaccinated. So if you got COVID and you get vaccinated, you have super immunity. Get vaccinated. Get at least 1 dose of vaccine. I would say, though, that if you have been vaccinated and Omicron comes through the population, is not so severe in the vaccinated population, and causes infection, and you get boosted because you got Omicron, it may be, I mean, I'm trying to be optimistic. It may be sort of the beginning of the end of the pandemic, right? It may be that so many people get vaccinated or boosted or protected that we may be, it may be a blessing, but boy, I'm worried that it's going to be at a significant pain. Let's not forget that we have already lost over 800,000 Americans, over 5 million people globally. And I just worry that we're going to end this pandemic with over 1 million people death in our country as a consequence of COVID. This is an unspeakable and just an incredible amount of deaths and suffering. And honestly, I'm not sure this is what we need. So again, I emphasize, don't get COVID. Get protected. Do whatever you can to prevent infection. That should be your goal.
I agree. And that's not even taking into account in the extreme suffering that you just spoke about. That's not even taking into account the idea of long COVID and all of the symptoms that people can endure for a very long period of time after having an infection. There's also been a lot of conversation about whether or not we were going to need to change the technology, the vaccines, to be an Omicron specific variant vaccine. And in the past week, we had 3 T-cell studies come out. T-cells are critical to our immune system because they are our second line of defense. If neutralizing antibodies can't catch the virus before it infects our cells, then T-cells are activated, and protection from T-cells is harder for viruses to escape. The results from the studies so far look great, and we haven't been able to say that very often. The studies look great. T-cells continue to work very well against Omicron. So I have 2 questions for you about this. Do you think this supports the theory that though the number of infections will substantially increase, we will largely stay out of the hospital if you're vaccinated with our current vaccines? And secondly, do you feel that these data are sufficient to make us pretty comfortable that we don't need an Omicron specific vaccine?
I think it's a very complicated question, but my short answer to both of them is yes. But again, I caution you that if the numbers of people infected are huge, we're still going to have, even as a small percentage in hospitalized, we're still going to have a significant number of people hospitalized and a strain in our healthcare system. I remind people that our hospitals don't have a lot of surge capacity. We run our hospitals like airlines at capacity, right? I mean, there's very little wiggle room in hospitals. And if you get a little bit of a surge, you rapidly overwhelm the system. And that I think has been an important lesson throughout this pandemic, is that we don't have a lot of surge capacity in our healthcare system. The other thing I would say that worries me about Omicron is that the currently available monoclonal antibodies, primarily the Regeneron monoclonal antibody that we have relied upon a lot because it was very effective in patients with Delta infection, has essentially no activity against Omicron. There are other monoclonal antibodies that are appearing that have some efficacy, but the one that has been the workhorse up to now, which is the workhorse of treatment, which has been the Regeneron combination, has no activity. So, I mean, I do worry that if some of our treatments are being importantly impacted by this new variant. Now, the good news is that the orally available medications, the one developed here at Emory, molnupiravir, that has yet to be approved by the FDA, but was at least recommended for approval by the advisory committee, and Paxlovid, the one produced by Pfizer, appear to be both effective against Omicron. And again, in his plan announced on December 2nd, the president said making antiviral drugs available to everybody. And I know that the government has bought millions of doses of both medications. Hopefully we'll have them available, because having drugs that we can give to people will be critically important. Not only do they prevent the risk of severe disease and hospitalization, they also decrease the viral load in individuals. And by doing so, they decrease the possibility of transmission.
It's so important to be able to decrease the possibility of transmission. That's an incredible addition that we're going to get from these antivirals. Let's turn to US data specifically. On December 13th, 2 days ago, there were more cases of COVID-19 in the US than at any point in time during the peak of the Delta wave, including the peak day, which was on August 30th. And as you said earlier, more than 800,000 people have lost their lives to COVID-19 in the United States. Yesterday, almost 1,400 people died of COVID-19. 30 states have now confirmed an Omicron case, and we can certainly assume that it's in all 50 states and territories. The proportion of coronavirus cases in the United States caused by the Omicron variant has increased sharply while we are battling still high levels of Delta. During the week that ended this past weekend, Omicron accounted for almost 3% of cases across the country, up from just 0.5% the week before. And while that may still sound really low, in New York and New Jersey, Omicron is already about 13% of the cases being seen. So the doubling factor is really striking. And as some comparisons, in Europe, the estimates, particularly looking at Denmark, which has very similar vaccine rates to the United States, they are doubling every 2 days with cases of Omicron. Different though in the United States, unlike other countries, we were still and are still substantially battling Delta and the spread of Delta and the way it's circulating in the United States. Do you think that Omicron is going to become the prevalent variant? I know you spoke about this earlier, or do you think they're going to have both of them going on in the United States?
For a while, we're going to have both. And in fact, I was talking to colleagues in Miami last night, and they were saying, while a big percentage of their infections are now Omicron, when you're in the emergency room diagnosing somebody, you don't know if they have Delta or Omicron. So you're giving them monoclonal antibodies without knowing if they're going to work or not, because there's no quick way of knowing. So in a way, you're battling both at the same time, which really increases the complexity of the management of these infections.
Absolutely. And in the flu season, we were given a gift last year. We had almost no flu cases in the United States compared to previous years. What are we predicting for the flu season this year?
Same thing. We're seeing flu go up. So we may be, we may have, double trouble. We have COVID when we have flu together. I was talking to a friend a couple of days ago who said, a bunch of his friends got sick and they all thought it was COVID and they got tested for COVID. It was negative, but they all got influenza. We already saw in the MMWR a couple of weeks ago a report of a huge influenza outbreak at University of Michigan among students. And so we got to get our flu vaccination rates up. And we are not doing that. This year, we're actually, our vaccination rates for flu are much lower than they've been in previous years.
That's very unfortunate. They were so high last year, and additionally, people got the flu vaccine on the early side. And to remind everyone, you can get the flu vaccine at the same time you get COVID vaccine or you get your COVID booster. There's no need to separate those in time anymore, which originally was suggested.
Absolutely. Get them together, go and schedule them, and do that this weekend. Good thing to do.
It would be a very good thing to do. The holidays and winter breaks are coming up. We're going to have college students coming back home, students, other students at home, family gatherings. You've already discussed a bit about the need to test before you get together and being a little more cautious depending on who's going to be with you. What are your feelings about all of us needing to be back wearing our masks when we're in public spaces?
I have not taken off my mask. I wear my mask when I'm in public spaces and I'm with a lot of people. But unfortunately, the reality is when we get together in small groups, when we get together in our household with families, we are not wearing our mask. And that's why I emphasize for the holidays is if you're not vaccinated, in a very polite way, if you have your cousin or your relative who's unvaccinated for whatever reason, you need to say, I'm sorry, but we probably don't want to get together with you this holiday season. We can Zoom you in, or you can wear a mask all the time. But let's get everybody vaccinated, ideally everybody boosted, and get some testing done. We can get together safely for the holidays, but we need to do it, by taking additional precautions. I just think that it's very hard. I think we're all tired of this. But the virus is not tired of us, and we need to continue plowing along.
Absolutely. I want to take a moment to pause and think about the past year. It's been 1 year and 1 day since the US began vaccinating against COVID-19. For many people, that moment felt like a science breakthrough. And I think you and I would both say that it was, to have a vaccine that worked so incredibly well, developed in less than a year after we began the fight against this pandemic. It also raised a lot of hopes that we were going to work our way out of this pandemic tunnel. What are your thoughts about what we've been through in the past year?
It's been an up and down, right? And it's been there's good things and bad things. I think we're clearly in a better place now than we were before, but even after all US adults were eligible for vaccination, since then we've had 200,000 people die in this country, and the great majority of them have been unvaccinated. And I think, to me, what's been really sad is the fact that we have continued to fight this virus, not as a virus and as a public health emergency, but we have continued to fight it in a partisan way. And we have, pro and against vaccine, pro and against masking. And we have, I think we need to get people to come together. We all need to work together. We all need to end this pandemic together. The divisiveness caused by this virus, to me, is one of the most difficult things and one of the most lasting side effects of this pandemic that I think is going to take some time to heal. So let's be kind to each other. Let's be sensible, and let's take care of each other. We can't stop this pandemic, but we need to work together, and that also includes global cooperation and global collaboration. We are not doing a good job vaccinating the world. We're boosting the US and not vaccinating the world. We got to get the world vaccinated. That's where the variants are emerging. If we don't do a good job vaccinating the world, we're not making the progress that we need to make.
So very true. Dr. Del Rio, thank you for joining me today, as always, and for the update on Omicron, as well as your holiday wish that we all would desire to combat this virus together and recognize that we're so very connected across the world. For all of you, thank you for watching. Please keep doing the things that we know will protect you from COVID-19 and will keep your community and family and loved members safe. Please get vaccinated if you're not yet vaccinated. Please get boosted if you've already been vaccinated. That's 6 months after an mRNA vaccine series and 2 months after a Johnson & Johnson vaccine. Wear your masks indoors if you're in public. And remember that testing is also a very good tool to prevent more cases of COVID-19. We wish you all a very safe holiday season and winter break. Thank you for watching.